Thank you, Peggy. Hello, everybody. My colleagues. And today webinar, I will speak about the clinical application of GentleMax for pigmented and vascular lesion treatment, as well as dermal rejuvenation on Asian skin. Most people are interested in these kinds of treatment. These kinds of problems are main interest for most of the people. Hyperpigmentation, broken vessels, crossfit, and dull skin, deep furrows, eyelid problem, infraorbital hollows, and nose reshapings. But in Asian skin, many people are interested in hyperpigmentation treatment and wrinkle treatment and skin sagging problems. GentleMax Pro is composed of 755 alexandrite laser and 1064 Nd:YAG laser beam with a long pulse setting. So this device can treat pigmented region and vascular region and skin rejuvenation. And also it is effective for hair removal in all skin types. GentleMax Pro has a very impressive specifications. First of all, it can produce very wide range pulse widths, and also it can produce in various spot size treatment is possible. So it can use many kinds of different spot size treatment is possible, and also from 0.25 to up to 300 milliseconds, we can set to very different pulse duration, depends on the skin condition. So we can also choose DCD or air cooling. So they provide a sufficient level of fluence. Actually, the long pulse laser is not a specific scientific terminology. So we represent millisecond and microsecond laser. We call this one as a long pulse laser. GentleMax Pro produce this pulse duration range from 0.25 to 100 milliseconds. In long pulse laser ranges, the main photobiologic responses are vaporization and coagulation and the thermal ablation, especially in high fluence. These three photobiologic responses are main changes. When you use GentleMax with sufficient DCD, we can expect collagen degeneration or coagulation or denaturation. And with a low intensity, we can expect hyperthermic changes. But if we don't use DCD, if we turn off the DCD and if we treat the skin region, sometimes we can expect skin vaporization. With a high fluence setting with a small spot size. So, in summary, these three groups are main indication of GentleMax. Pigmented regions are induced by photothermal effect on the melanin. Vascular regions, the photothermal effect influenced on hemoglobin. And the skin rejuvenations are induced by cytokine-related skin rejuvenation process after a gentle heating of dermal layers. So the vascular regions, we use mostly 1064 Nd:YAG laser beam. We don't use too much the Alexander laser beam much. And this is a list of pigmented region treatment performed by GentleMax Pro. Most of these skin regions, pigmented regions, conditions are epidermal areas. And then sometimes it is effective on, we can use compound nerves, also in some cases, Becker's melanosis. So mostly like lentigen, freckles, some clumped melasma and porokeratosis, several keratosis, PUL, and the Gaffeole. Everything is mostly epidermal dominated regions. Alexandrite laser beam has, compared to 1064, it has a more higher melanin absorption. So almost about roughly 3 times higher than Nd:YAG laser beam. So for the pigmented regions, 755 is used mainly as for the pigmented region treatment. This slide shows the clinical responses after the 755 alexandrite laser beam treatment with GentleMax Pro. As you can see, this microcrust appeared after 7 days later. We checked this photo after 7 days, and this response is very similar to the after the IPL treatment. And after 2 weeks later, these microcrusters is fallen off. So compared to Q-switch nanosecond lasers, the melanin and the melanosome response is very different. Q-switch nanosecond laser, the effect on the melanin makes shattering of pigments, but the GentleMax and the IPL treatment, they has a tendency to make pigment as some condensation effect. So the clinical effect is different. So like this, when we treat several keratosis with hypokeratotic type, as you can see, some thick skin epidermal lesions, we expect vaporization and skin coagulations. In a very thin layers, thin lentigens, I use these settings, and we can expect with 2 times of stacking treatment, we can make some similar epidermal changes like before. So as you can see, this picture, long pulse alexandrite laser, if you use mostly the epidermal lesions, mainly, if it is very thick, you use select 3 milliseconds. And then if it is less than 0.3 millimeters, use less than 1.5 millisecond to around 0.45 millisecond. And in this case, sometimes we stacking the treatment, but when you're stacking the treatment, be careful not to stack very quickly. So after laser treatment, during the laser treatment, with DCD sprayed on the skin, so it protects the surrounding epidermal layers. It protected the epidermal layers. So it became more safer compared to other devices. So actually, penetration depth of alexandrite laser beam is quite influencing very significant layers. So up to deep, some more dermal layers more deeply, it influences some thermal influence. So it appears as an erythema after a few minutes later. So we expect significant thermal responses with 755 long pulse laser. So before the treatment and after 20 seconds, and after 3 minutes, we can see the gradual erythematous changes appears. So we should remember the thermal response appeared not so fast. So we should wait some few minutes to check up the thermal responses. The Q-switch alexandrite laser also is very effective for the pigmented region treatment. Like this picture, clinical response is quite impressive. But when we treat the sun-damaged areas, in cases of some damage on dermoepidermal junction, we expect some kinds of post-inflammatory hyperpigmentation. PIH is it appears more commonly in the sun-protected skin area compared. So like this. If the skin basal membrane zone is disrupted like this, we expect more PAH can appear after the skin treatment with a long pulse laser. Also with the Q-switch laser, also same thing. So in this condition, first of all, we should treat another supportive treatment to recover the integrity of dermal junction through the many kinds of energy-based devices like RF and other devices as well. Like this case, freckles are very easy to treat with the GentleMax Pro. But like this thin and pigmented region, I use a 12 millimeter diameter spot size. But if it is thick and hyperkeratotic lesion like several keratosis, I use a smaller spot size, 6 millimeters. You can see the very nice result. This is another case of several keratosis. I use 6 millimeters with 3 milliseconds. But in the thin layer with not so dark lesions, I select shorter pulse duration, 0.5, and use 8 millimeter spot. So I can do some the laser, some stacking, 1 or 2 or about 2 times of stacking also possible. Depends on the response. Like this complex case with this case combined the case of abnorm and melasma. In the abnorm is dermal lesions, dermal pigmented lesions. So that's why I use Q-switch Nd:YAG laser to treat abnorm areas, and some clumped areas of the skin pigmented lesions. I use the long pulse Alexander lasers with a 6 mm spot. So I use the combination treatment. But when you use another doctor did some study with single pulse, long pulse Nd:YAG, single pulse, long pulse alexandrite combined treatment. He did in pigmented nevus. And then after the treatment, you can see very thick scabs here. The crust fallen up after the passing the times. And finally, it became the scar-like lesions. So it means long pulse alexandrite laser can make overheating of the skin dermal layer. So the overheating eventually will leave some scars. So when you treat the long pulse alexandrite laser, you should be careful about this one, about too much heatings, bulk heatings. So if we treat pigmented nevus like this, so Dr. Hong in Korea, he suggested the new method of technique of a window technique. And the window technique is treating evaporating the epidermal layer, remove the epidermal layer with the erbium YAG, and afterward treating the GentleMax Pro in the pigmented regions. This combined treatment can make a better result like this, before and after the treatment. But if the congenital melanocytic nevus is small, just only GentleMax lasers can make a good response like this. If it's thick and big and needs a window technique, but it's small, we can only treat with GentleMax Pro. Melasma actually is a very challenging skin disease for every dermatologist because it has it appears as various patterns, and also there are a lot of different skin conditions involved in the melasma, and also many pathophysiologic changes are involved in melasma, like base membrane disruption and the solar elastosis, increased vascularization, and the melanocyte migration to the pedunculation, and the epidermal and the dermal, some pigmented lesions, and the master cell increase like that. So lots of some pathologic responses are involved. So that's why we use many kinds of the treatment method, like from cream and tranexamic acid and laser toning and some another laser treatment and skin rejuvenation and recovering skin barriers. So you should combine these kinds of treatments. And then among this treatment method, what is the role of long pulse laser? We have one question. But so this we can guess one question like this: can long pulse Alexander lasers can substitute laser toning or picosecond lasers? But the answer is effective in some cases, but not always effective for melasma. So it means for the melasma with even tones, picosecond laser or laser toning is recommended. But the melasma has a superficially clumped, disputed melanin-bearing skin lesions. A gentle toning treatment method is effective with the GentleMax Pro. And the vascular telangiectatic lesions combined areas, pulse dye laser can help to reduce the melasma. So this is a case treated by Q-switch laser or pico laser toning. This is before the treatment, and you can see the even distribution of melanin on the suprabasal areas treated by Q-switch lasers. And this is a case of more clumping of the skin pigment region. This area is a good indication with the long pulse alexandrite with a gentle toning method. Before the treatment, after the treatment, we can see the better responses. Like this, she did the treatment with another clinic, and we can see the more clumped area on the skin. So we expect a very nice result. And so I used the gentle toning method, so you can see the nice response. This is another case, similar to clumped areas, treating before the treatment, after GentleMax toning treatment. This is similar. But dispute on the cheek areas mainly, so use the gentle toning method treatment. 10 millispot, 0.40 milliseconds. This is a similar, but combined with the freck-like, lentigen-like lesions. And so I combined with the gentle treatment and also spot treatment. This young man, I did treat with the laser toning, but the response is not so impressive. So I switched to the GentleMax laser with the spot treatment and the gentle toning treatment, GentleMax toning treatment. As you can see, some in melasma, lots of some prominent vascular network is founded under the melasma regions. So pigmented regions areas, you can see some more increased vascular networks on the subepidermal region and the upper reticular dermal regions, and both of areas. So the like a weaving laser can make improved the melasma areas, some areas. This is before. This is I've taken this picture 6 years. This picture is 3 years later. I didn't treat any treatment in here. I only removed these 3 spots. And but she is done very much in Australia, and I can see more spreaded melasma area in here. It's along the vascular blood vessel network areas. So it means too much increased vascular areas, like some telangiectatic lesions, is more commonplace to appear more melasma skin lesions. This blood can treat with weaving lasers, combined with GentleMax and some laser toning. Another case, similar treatment, the weaving laser and the GentleMax, and some non-invasive radiofrequency treatment. Lentigens are very common problems in Asian skin. But it's very common, but not always easy to remove because of this composed multi-layer, and we can see some irregular red ridges. This case was treated by GentleMax very easily with a 12 millimeter diameter. You can see very nice result. This case is more hazy skin pigmented distribution. So I used 12 millimeter spot size, 3 millimeter seconds, and I treated the 10 millimeters with the gentle toning mode treatment, combined these two methods. And then she has a similar pigmented lesions here. I used these two different methods. And I used a small spot to treat a very tiny, not very dark area spot, and combined with a general treatment with 12 millimeters spot size. This lentigens are not so dark, so I used a 6 millimeter, 1 millimeter seconds perspiration. This is another freckle and lentigens similar to 6 millimeter. Very nice result. In several keratosis, I use a 6 millimeter spot size and a 3 millisecond. On the hands, also similar. The result of the GentleMax is much better than the response of 532 nanometer with the Q-switch Nd:YAG laser beam. But Q-switch Nd:YAG laser sometimes makes some pH more than treated by GentleMax Pro. So GentleMax Pro is better than Q-switch Nd:YAG 532 on treating these kinds of skin lesions. And labial pigmented macula is very nice result with only one treatment. And the PUL with a couple of times of treatment, you see not complete, but impressed very significant. Gafiola is also very nice, which I used 6 millimeter, 1 millisecond. This treatment was this photo was taken by after 6 treatment and 1.5 years later, and no recurrence and much improved state conditions. I took this picture 7 years later. This is a result after 7 years. I didn't treat it after the 6th treatment. So the treatment is the case of Gafiola macula on the thigh, and on the more pigmented regions, I can use more longer perspiration. The porokeratosis treatment also possible with the same settings. The response is good with only after 1 year of treatment. Let's move my talk to vascular treatment. We use a long pulse Nd:YAG laser to treat the vascular lesions with GentleMax Pro. When you compare to the pulsatile laser, we expect thermal damage hitting is focused on the center when we use for long pulse Nd:YAG. If you use 532, thermal hitting is focused mainly on the lower hemisphere, so it's more close to the blood vessel areas, vessel wall areas. So it's the hemorrhage or some purpura is more common. So as you can see, this picture, the thermal damage is starting on the center. When you increase the perspiration, thermal damage also increase. From 3.5 millisecond, 4 millisecond, 5 millisecond. So and it's spreading to the surrounding areas from the center. Dr. Kim and their colleagues, he did a study and compared the pulsatile laser and the long pulse Nd:YAG laser. And according to their studies, the immediate rate reactions are different. And especially the blister and the linear furrows can be seen in long pulse Nd:YAG lasers. So the telangiectatic lesion is improved after the treatment, but we should be careful about making the blister or linear furrows. You should not make these conditions. So this is before the treatment. After the treatment, the blood vessel is improved very much, but you can see some small area is slightly indented. This is a bit before, and after 10 minutes later, you can see the most of the telangiectatic lesions are improved. But 1 week later, they come back again. So even though after 5 treatments, some areas still remained. You can see. But most of the bigger, thick blood vessels are improved. Venulectasia also very good indications. These venulectasia also responding where with the GentleMax Pro with a 1.5 millimeter diameter spot size. Used 20 to 40 milliseconds per stage. The spider angioma is very nice indications. We should use treat the central area first. After the central area treatment, the surrounding areas, if we combine the V-beam laser, we can make a much better result. Targeting the central area with these parameters. This is another spider angioma on the center, targeting on these central areas and treating afterward, treating the surrounding areas. Another case of spider angioma is good, very nice, since we do only after 1 treatment. The port-wine stain also in the hypokeratotic type is responding well with the treatment of long pulse Nd:YAG laser. It can make some scabs. Eventually, it leaves some slightly whitish area, but the color is same color with the skin, another skin color, so not fibrous skin scars. So this in the Europe, I used many places with long pulse Nd:YAG GentleMax with combined with V-beam lasers. We can make a better response after that, like this. He has some more hypokeratotic type on the temporal areas. I used the combined GentleMax Pro with this setting, and then combined with a V-beam laser. So the response after the 5 times of treatment can be significant. These differences. Some people has periocular veins, and then here like this, with the long pulse Nd:YAG laser, we can diminish the more bluish color by treating some 1.5 millimeter spots with some partially areas. Don't need all the areas, some small area. And the dark circle on the eyelid, and he has a dark circle here with a vascular component. Here is you can see some bluish lines. I used the long pulse Nd:YAG with this 3 millimeter spots. Treated this line, and this surrounding area I treated with the V-beam laser. So we can make better these lines. And actually the dark circle, it takes time to do the treatment. And the venous lake. Venous lake is different from spider angioma. I recommended to treat this one from surrounding areas, not from the central areas. And if you treat central areas, because it's on the central area, much more blood vessels here, so you can expect more explosive changes after the laser beam. So we can expect some scar formation possible. So please treat the surrounding area first. I selected these parameters. The pigmentation and then the broken vessels on the face, combined the case, combine the 755 and 1064 altogether, you can get a very shiny and bright color, and you can remove these blood vessels in one time of treatment. And then so he did 2 times of treatment. When you use a 755 Alexander light laser for the vascular lesions, we can make this kind of changes. If we select 3 milliseconds, we can make more peripheral. And if we elongate the perforation more and more, the peripheral change diminishes. But also, treatment effect also diminishes. So the effect one is 3 milliseconds, but we always encounter some peripheral changes. Sometimes we can make this vesicle-like skin lesions appears with 3 milliseconds. So this is too much heating on the skin. So I treated the nevus flammeus on the arm. I treated with 755, 6 millimeter, 70 joules. And then, as you can see, 3 days later, you can see more peripheral changes, especially with a small size, like the 6 millimeter. But this peripheral change lasts more than peripheral after pulsatile laser. So 12 days later, we can see still more peripheral changes. So it is a little different from the beam laser, the peripheral response. Okay, let's move my talk to skin rejuvenation. This technique is so-called the Genesis technique. 1064 nanometer long pulse Nd:YAG laser it can deliver energy to deep dermal layers, where the heat-induced damages resulting on collagen and elastin remodeling with little or no downtime. So weekly is this wavelength is weakly absorbed by melanin, so that it allows for safer laser treatment. Dr. Lobati and his colleagues it did a study, compared one side with fractional erbium YAG and the other side by long pulse Nd:YAG. But after 3 times of treatment, the conclusion conclusion is the both sides there are no noticeable differences between 2 lasers. So it means this side right side is fractional, and the left side is a long pulse Nd:YAG lasers. Her face, the response is very nice in both sides. So in both sides, the clinical responses are quite impressive. So this Genesis technique is performed by is induced by the apodermal heating, general heating. There are a lot of microvasculature in epidermis. The 1064 long pulse laser, it generally heating the epidermal vasculature. So it induce vascular inflammatory responses on this layer. Finally, they produce cytokines involving the skin rejuvenation. So we can expect the effect, the skin texture improvement, skin fine line, and the pore size, inner pore can be improved. So this is the before, after the procedure. You can see the collagen is remodeling, is increase the collagen fibers in the epidermis layers. In the EM findings, we can see the collagen bundles are increased before and after the treatment. After the laser treatment, we can see the new neocollagens here. So this is a clinical pictures before and after 5 times of treatment. You can see the skin texture and the skin color also improved. These pores, inner pores and skin saggings, wrinkle skin fine wrinkles also improved. It's a tiny pores become tiny, and the skin texture surface also improved. And she has a pores and hazy skin pigmented regions and fine wrinkles around here. And after the 3 times of treatment, the skin surface conditions is better before compared better than before the treatment. She has enlarged wide pores on the nose, and this condition also improved by Genesis treatment method, and with this same all the parameters. She was taking the minimal dose of isotretinoin as well. It doesn't matter, 10 milligrams a day for not very long time. This is a blackhead, and then the laser beam of GentleMax is targeting the blackhead, and then it produces thermal heating. Finally, the pigmented areas absorb the energy and produce some degree of thermal damage and induce skin rejuvenation effect. So we can see the minimize the pores, and the skin blackhead is also improved. And also, someone who has a trichostasis, we can also use 755 nanometer long pulse beam. So it also can make heating on the pore, surrounding pore area. It's produce near collagen on the surrounding pore areas. It can diminish the pore size. It can improve the skin condition. In summary, the long pulse alexandrite laser can treat many kinds of pigmented regions without serious side effect, from microsecond to millisecond pulse duration. To solve the puzzle of a complicated melasma treatment, long pulse alexandrite laser GentleMax Pro can be introduced effectively in selected conditions, like some clumped pigmented region containing melasma areas. And depends on the amount of distribution pattern and the depth of melanin pigmentation, you should select proper fluence with the appropriate spot size, pulse duration, and the density setting. These all settings are important to get a nice result. Long pulse Nd:YAG lasers is effective for various vascular problems as well as skin rejuvenations. So it's also effective for another cutaneous disease treatment like verruca or some onychomycosis treatment as well. Okay, thank you for your attention. So, thank you.
Thank you, Dr. Lee, for your wonderful presentation. Now we have 15 minutes Q&A section. So the first question I received is, Dr. Lee, we see that in most cases you got significant results after 1 or 2 treatments for the laser toning. Would you suggest that to have maintenance treatments after the first treatments? So it means, would you consider to have continuous or a series of treatment after the first treatment?
Some cases I did one treatment, but many cases it's a multiple treatment, 2 or 3 times also. There are many, and also, but not like laser toning. Some treating some clumped areas, clean those areas. I combine the laser toning or pico laser treatment altogether. So the treat more laser toning or another pigment treatment, and combine with the GentleMax Pro in some areas.
So second question is, how many shots that you suggest for laser genesis?
It is not decided by shot numbers. I don't count the shots. I check the skin dermal heating I check up the skin thermal heating with my, and then not to increase the temperature too high, and then make cooling afterward, and then treat once again, and some more shooting more shots there. Depends on the responses.
And one more question is, can we use gentle laser toning and genesis technique in skin type 5 and 6?
Mhm. In skin type or 6, and the gentle the genesis treatment is possible, but in those conditions, the temperature is increasing very more quickly. So I don't use the genesis treatment technology. So in the theory it is possible, but in the practically the temperature increase is more faster than Asian skin, in East Asian skin. So I don't use the Genesis technology for the skin type over 6. And also 755 is not recommended for skin type 5 or 6.
See. So next question. Have you used the GentleMax Pro for hair removal, neck hairs? If so, what are your setting and how many sessions do you recommend to patients?
Hair removal.
Yes.
Uh, Hair removal areas in the body areas like underarm and some bikini line. I use 18 millimeter spots with 755 Alexander laser. And then I use setting the DCD more higher, about 40 to 30, 40, 30, like that. And then the fluence is depends on the skin type. From the bright color, I use 16, and relatively dark 14. But for very dark skin type, like a skin type 5 or 6, I use only 1064 low pass NDR, basically. I don't use you should not use 755 for skin type, very dark skin type. Be careful to use 755 for dark skin type. And especially 5 or 6, you should not use. And then for the skin, the hairy areas of the chin and the very thick hairs, I select the 1064 NDR laser as a 30 milliseconds setting with a 35 joule or 40 joules with a 40 30 DCD setting. And then on the face, if there's a lot of very dense hairs, density of hair is high, should not treat in one time. Treating the skin, the hair area in the surrounding area with the 1064, and then the central area, if we use a 1064, it can make some blister. So the too much hairs, use a 755. For the in the high density areas, I use a 755 with a 18 millimeter spot size with a DCD 40-30 DCD setting. And the most important one for with the hair removal treatment, the post-treatment cooling is very, very, very important. I perform more than 15 minutes of cooling after the hair removal treatment. In dark skin type, I put the cooling ice pack more than 20 minutes. That's very important. and some give some medicines. Yeah.
Thank you. The next question is, when treating with 6 mm in pigmented spot, do we need to protect the long pigmented area?
Aha. In the with a 6 mm spot, with a, if you use a DCD more than 30 like that, and then the surrounding damage is not so impressive usually. But we can also protect with some under the white paper to protect the surrounding areas possible. But if there are not skin, the surrounding area is not so pigmented, the surrounding the damage is not so impressive. When you use, especially when you use less than 1.5 millisecond, and the thermal damage is not significant if we turn on the DCD. But if we turn off the DCD, there's some thermal damages.
The next question is, how about the hypopigmentation side effect from long pulse Alexandra laser in Asian skin type?
I didn't see any hypopigmentation. There was in a few cases hypopigmentation possible, but no hypopigmentations.
So it seems like many people are asking about their genesis treatments. One more question is about what's the treatment interval for the genesis treatments with the GentleMax
That
pole?
1064 laser the Genesis technique usually about 1 month of interval is enough, I think.
So what is the setting for the skin type 4?
Setting is always similar to 0.3 millisecond, 300 yeah,
So how
300
about
microsecond,
the post?
16 or 17 joules. There are no DCD.
How about the post laser treatment?
Pulse laser treatment.
Yeah, for the after the genesis treatments.
Mm-hmm.
Any post care treatments?
Also, the skin should be cool, post treatment cooling with the ice pack and some medical skincare cooling with a collagen mask or some other some medicines like some antihistamines like that.
Next question is, how about using 1016 for the PIH? And what setting do you use for this, and how many sections usually?
Also for PIH,
Yes.
PIH I don't use with the long pulse Nd:YAG. PIH I can use 755 Alexandrite mode with a setting of 8 millimeters spot size with a 1.0 millisecond and the treating more gently. With the DCD is about 2020 or 2010 like that. And you should check up the response. It's not too high, just for small changes.
Next
Very small.
question is interesting. Can we combine the long pouch with the pickle for melasma treatments in their Asian skin type 5?
Asian skin type 5, yeah. The
Combination treatment.
combination also possible, but I don't recommend GentleMax Pro, especially 755 for skin type 5. In the skin type 5, I recommend use the even QCGN, the laser toning, also very low energy, low flux, and very short treatment. Also with a larger spot size. And then I prefer to use dark skin, the radio frequency, like a E plus. Radio frequency, non-invasive radio frequency can make a gentle, very gentle skin rejuvenation effect. It can put, it can make better the skin pigment.
Next question, do you have experience to utilize the long pulse ND yet for Gold PTT, the photothermal therapy for the acne reductions or pore reductions in Korea?
Aha. But I didn't have experience with the gold. Yeah. Gold with the GentleMax Pro.
One more question is, what about using 1064 for acquired junctional melanocytic with NIFIF? What setting and treatment intervals?
That setting is similar to the setting of several keratosis. Use a 6 mm spot size. And then the fluence is decided by starting the lower setting first. And the DCD is about 2020. And then if it's too much pigmented, and select 1.5 millisecond. But if it's not so pigmented, we can try the 3 milliseconds. It is different from conditions. You should try first some small area first.
So I think we have two more questions only.
Mm-hmm.
One question is, what is the clinical endpoint for the blackhead treatment?
A blackhead treatment. And then the blackhead treatment, the blackhead doesn't disappear very quickly. It's only some small changes. So like some, it's difficult to say, but with 3 milliseconds first duration and 12 millimeter size spot, and then treating the skin with about 24 or 26, depends, and then treating some small areas first.
So
And then you can try with the 10 milli spot size also possible. And then with the treatment, the blackheads responding in some extent. That's the endpoint, I think. Sudden changes, not, but some small the changes of the blackheads. Yeah.
the last question is about the dark circle. Just
When
like
you use the blackheads treatment, you should you should use the DCD 30-30 like that. If you don't use DCD, you should not do that procedure. Please turn on the user. Please use a DCD. Yeah.
see. The last question is about the dark circle. Just now you mentioned about 1064 and weaving combination treatments. So how many treatment sessions would you suggest to have, and how about the treatment interval?
In the dark circle.
Yeah.
Yeah. So for the dark circle areas, the picture I showed is a combination of bluish color and reddish color. The reddish color is treated by weaving, and the bluish color I can try the long pulse and yak, but sometimes we need a couple of times of treatment. So in cases I use about 1 month of interval.
So I think most questions have been answered. Thank you so much, Dr. Lee, for your presentation and sharing
Welcome.
today.
Yeah. It's
I
my pleasure.
believe all of us have learned a lot. And also thank you everyone for your participation and all of your scientific, clinical, and practical questions. Hope you enjoy it also. Take care, everyone. Goodbye.
Okay, bye-bye. Thank you.
Bye.